Dear students,
I am Dr. Kumar, Assistant Professor, Department of Zoology, Government First Grade College of Art, Science and Commerce, Shira, Tumkur District. The topic of today's lecture is the continuation of the previous class, that is the study of human louse-borne diseases. In the previous class, we have studied the relapsing fever and typhus fever. Today, again, two more diseases, that is trench fever and Vagabond's disease. So this comes under paper 4, that is insect vectors and diseases, BSc 4th semester Zoology, Tumkur University. Study of human louse-borne diseases. So in that, trench fever and Vagabond's disease. The first is trench fever. What is trench fever? Trench fever is also known as 5-day fever. Once it appears, once it symptomatic, the individual will suffer from this fever continuously for about 5 days. And it is also called as Quinton fever. Quinton fever and urban trench fever. Quinton fever and urban trench fever. Quinton fever because the bacteria which is responsible for the trench fever is Bartonella quintana. Bartonella quintana. That is the reason why it is Quinton fever. And urban trench fever, again it is predominantly, and it is a modern term. So this can be seen, epidemic of this fever can be seen in the urban areas also. So that's why it is also called as urban trench fever. So it is a moderately serious disease transmitted by the vector body lice. The disease is caused by the bacterium, that is Bartonella quintana, found in the stomach walls of the body louse. So this slide shows the bacteria, that is Bartonella quintana, which causes the trench fever, and the vector is our human body lice. So this is also the image which shows the Bartonella quintana, that is Rachelimaceae, responsible for the appearance of the trench fever. The symptoms of this trench fever includes the high fever, severe headache, pain on moving the eyeballs. If you move the eyeball on either side, you can experience the pain. Soreness, that is the general body pain of the muscles, legs and also the back side. And frequently hyperesthesia, that is the physically the individual become very sensitive. Physical sensitivity is what is called as hyperesthesia of the shins, especially the front of the lower legs. The front shank anta navenu karitivalla, that is tibia fibula region idiyalla limbali. So that is what is called as the shins or lower leg portion will become painful. So again the pain in the legs, heart failure, sometimes the heart failure occurs only in special cases. Neurasthenia, that is general illness, general body ache, neurasthenia, cardiac disturbances, heart problem and myalgia, complete muscles pain in the body. All these are the symptoms of the trench fever. Treatment measures involves as I told you in the previous class, there are wide spectrum of antibiotics are available to treat the bacteria and virus in the drug stores. Among them, tetracycline and chloramphenicol are found to be very effective in order to eradicate the bacteria Bartonella quintana. Tetracycline group of antibiotics, that is both doxycycline and tetracycline are commonly used. As far as chloramphenicol antibiotic is concerned, it is an alternative medication recommended under circumstances that render the uses of tetracycline derivatives. Okay, so where tetracycline illa anta helidre alternative agi chloramphenicol annu kuda suggest ಮಾಡ್ತಾರೆ. The treatment for bacillary angiomatosis is the erythromycin given for 3 to 4 months. So that is a different different bacterial disease which is caused by again the vector human body lice, that is bacillary angiomatosis. Transmission, the mode of transmission occurs through clothing infested cloths having body lice and the bedding, the infested person who uses the bedding materials, mattresses, bed sheets, etc. And the towels used by the infested person. All these three are usually containing the infestation, that is infected, the body lices are present. Okay, so the healthy person, if uses the bedding material, clothing, towel by the infested person, naturally get the infection. As far as the prevention is concerned, the clothing, bedding and towels used by the infested person should be laundered using hot water. ಅಂದರೆ ದೋಬಿಗಳಿಗೆ ಹಾಕ್ತಾರಲ್ಲ, ಅವರು ನೀರನ್ನು ಕುದಿಸ್ಬಿಟ್ಟು ಅದರೊಳಗಡೆ ಅದ್ಬಿಟ್ಟು ಅಬೌಟ್ 120 ಡಿಗ್ರಿ ಫಾರೆನ್ಹೀಟ್ 4 ಡಿಗ್ರಿ ಸೆಂಟಿಗ್ರೇಡಲ್ಲಿ ಅದನ್ನು ಕಂಪ್ಲೀಟ್ ನೆನೆಸ್ತಾರೆ, ಬಾಯ್ಲಿಂಗ್ ವಾಟರ್ಲಿ ನೆನೆಸಿದಾಗ. ಸೊ ಯೂಶಲಿ ದಿಸ್ infestation will be cleared and head lice will be died. Where this is not a practical or possible for some time, so the powder dusting with 10% DDT, 1% malathion or 1% permethrin is also found to be very effective. Different powders are also available in the drug stores like DDT, malathion, permethrin. The powders are available and they are also found to be very effective. And in addition, the ivermectin, the tablet ivermectin at a dose of 12 mg on 3 subsequent days. The first day, 7th day and 14th day has been given to the infested person in order to kill the infection which is present in the body, that is the bacteria Bartonella quintana. Delousing, that is the removal of or eradication of louses. Delousing, to control the house-borne diseases is delousing. That is the efficient delousing methods includes ಅಂದರೆ ಮನೆಯಲ್ಲಿ ಹೆಡ್ ಲೌಸಸ್ಸನ್ನು ಮನೆಯಿಂದ ಹೇಗೆ ಕಂಪ್ಲೀಟ್ ರಿಮೂವ್ ಮಾಡ್ತಕ್ಕಂಥದ್ದು, ಹೇಗೆ ಕಂಟ್ರೋಲ್ ಮಾಡ್ತಾ ಇರತಕ್ಕಂಥದ್ದು ಹೇಗೆ ಮನೆಯಲ್ಲಿ. ಸೊ ರೆಗ್ಯುಲರ್ಲಿ ಚೇಂಜಿಂಗ್ ದ ಕ್ಲಾತಿಂಗ್, ನಾವು ಹಾಕ್ಕೊಂಡಿರ್ತಕ್ಕಂಥ ಬಟ್ಟೆಗಳನ್ನು ರೆಗ್ಯುಲರ್ ಬೇಸಿಸಲ್ಲಿ ಸ್ನಾನ ಮಾಡೋದು, ಬಟ್ಟೆಗಳನ್ನು ಅವಾಗವಾಗ ಚೇಂಜ್ ಮಾಡ್ತಾ ಇರೋದು ಡೈಲಿ ಬೇಸಿಸಲ್ಲಿ, ಇನ್ಕ್ಲೂಡಿಂಗ್ ದ ಇನ್ನರ್ ವೇರ್ಸ್. ಓಕೆ, ಆ್ಯಂಡ್ ಬಾಯ್ಲಿಂಗ್ ಇನ್ಫೆಸ್ಟೆಡ್ ಕ್ಲಾತ್ಸ್, ಅಂದರೆ ಯಾವುದಾದ್ರು ಬಟ್ಟೆ ಇನ್ಫೆಕ್ಷನ್ ಆಗಿ ಹೆಡ್ ಲೈಸ್ ಅದರೊಳಗಡೆ ಬಂದಿದೆ ಅಂತ ಹೇಳಿದ್ರೆ, ಸೊ ಯು ಹ್ಯಾವ್ ಟು ಡಿಪ್ ದೋಸ್ ಇನ್ಫೆಸ್ಟೆಡ್ ಕ್ಲಾತ್ಸ್ ಇನ್ ಟು ದಿ ಬಾಯ್ಲಿಂಗ್ ವಾಟರ್. And also the use of insecticides like DDT, malathion, permethrin, etc. Okay, the uses of insecticide, the sprays can also be used, and the tablet ivermectin for the infested persons. So that is about the trench fever. The next, the louse-borne disease is Vagabond's disease. What is Vagabond's disease? Vagabond's disease, the intense itching and rashes caused by an allergic reaction to louse bites are common symptoms of body lice infestation. As other lice infestations, intense itching leads to scratching, which can cause sores and secondary bacterial infection of the skin. When body lice infestation is long lasting, heavily bitten areas of the skin can become thickened and darkened, particularly in the midsection of the body, that is in the trunk portion. So this condition is called as Vagabond's disease. So here what happens, once the person gets infected with a disease causing agent, it causes allergic reactions on the skin. Okay, so the louse in the louse bitten area becomes redness and rashes will be appeared. Okay, so the itching, the intense and severe itching leads to scratching. Complete ಆ ಪೋರ್ಷನನ್ನು ನಾವು itching ಆದ ಪೋರ್ಷನನ್ನು ಸ್ಕ್ರಾಚ್ ಮಾಡ್ತೀವಿ. So which causes the sores, the rashes, the secondary bacterial infection that takes place on the skin. Okay, so this infestation is long lasting. So heavily bitten area, so in the skin, that too in the mid region of the body, that too near the trunk region, so the infested region becomes thickened and darkened, particularly in the midsection of the body. So this condition of severely itching, scratching and rashes, thickened and darkened skin appears in the body. This condition is what is called as Vagabond's disease. So the symptoms includes the sudden onset of fever, intense itching, severe itching can be seen, chills, chili ಆಗೋದು ತುಂಬ, headache, severe headache, flu-like symptoms, general body ache, flu-like symptoms. Rashes typically begin on the trunk region. So they begin in the trunk region, then that is the midsection of the body, and spreads to the extremities of both upper extremity and lower extremities. The severe headaches and also the nausea is also one of the symptoms. These are all the symptoms of the Vagabond's disease. As far as the transmission is concerned, body lice are spread through prolonged direct physical contact with a person who has them, or through contact. Okay, so through body contact, so these body lices will be transferred from one person to the another person, either through the cloth or skin contact. Okay, so that is the clothing, bed linings or the towels, so that have been in contact with the infested person. Using all these or sharing these material with the infested person naturally get the infection. That is the mode of transmission. And as far as the treatment is concerned, the infested person is treated with pedicillicidae, a medicine that can kill the lice. Okay, so delousing can also be practically achieved. The boiling all cloths and bedding or washing them at a high temperature. So powder dusting with 10% DDT, 1% malathion and 1% permethrin is also found to be very effective in eradicating the disease causing agent. The oral ivermectin tablets of about 12 mg will be given in 3 different instances. First day, that is the 0, the 7th day and the 14th day will be given in order to kill the disease causing agent in order to get rid of the vagabond disease. So this is all about two louse-borne diseases, that is trench fever and vagabond's disease. These are the reference materials along with the link. And dear students, this is the time of COVID-19 pandemic. Second wave is operating now. Take maximum precautions. Okay, don't go outside. Even if you go outside, wash your hands very frequently by using soap or sanitizers. Cover the face, that is nose and mouth, by face covering or face mask. Maintain the social distancing of minimum 2 meters between the individuals. Stay home, stay safe, save lives. Thank you.